What is the state of your health? Do you have a case of male or female infertility? Have you been told you have a low sperm count? Do you have a prostate problem? Are you a lady suffering from abnormal menstrual problems? Never worry again. Zoe Fertility and Alternative Medical Center has all the answers to your health needs. At Zoe, we treat all kinds of health problems, including erectile dysfunction. Zoe Fertility Center has a state-of-the-art laboratory and an ultrasound scan services available. There's also the total body scan, which scans all your organs in 5 minutes. Yes, you heard right, in 5 minutes. Our pharmacy is well stocked with good and highly efficacious natural medicines, all without side effects. Locate Zoe Fertility and Alternative Medical Center at our Adenta new site behind the CAF International School opposite Mechanical Lloyd on the Adenta Ebri Road. At Odoko, we are near Nicolisi Hotel behind International Needs. Odoko Terrazzo. Call 0205 363614 or 0243 239534. Zoe Fertility and Alternative Medical Center, excellent healthcare, our hallmark.
Hello, let me welcome you to the Zoe Health Talk Show. My name is Dr. Fian from the Zoe Fertility and Alternative Medical Center. Today, we are talking about fallopian tube blockage. Fallopian tube blockage. Fallopian tube blockage accounts for about 20% of infertility cases in women. The fallopian tubes are part of the reproductive system of the woman. They connect the uterus to the ovaries. So you have, there are two. You have both the left fallopian tube, which connects the left ovary, and then the right fallopian tube, which connects the right ovary. Sometimes there are certain conditions that may occur that may lead to the blockage of the fallopian tubes, making it difficult for an egg to be able to travel through the tube so that it can meet a sperm for fertilization. Before a woman can conceive, what happens is that after intercourse, a man ejaculates an amount of semen which carries the sperm, and they travel through the uterus into the tubes, and then if there is an egg within the tubes, then it is fertilized, where pregnancy takes place, and then it begins to implant in the uterus. But certain conditions can disrupt this process and can lead to a case where there will be difficulty in the woman conceiving pregnancy. Now, the causes of fallopian tube blockage ranges from women who contract various infections of the urinary tract that may lead to the upper part of the uterus being affected, eventually causing the tubes to be blocked. For example, when a woman contracts the gonorrheal infection, which is a sexually transmitted infection, and normally you can contract this infection when a woman has intercourse with a man and who is positive for the gonococcal organism, and then the organism travels into the urinary tract or the reproductive tract of the woman. The organisms can travel up the uterus and enter into the fallopian tubes and begin to damage the tubes. This can lead to blockage of the tubes. Sometimes when a woman gets an infection like chlamydia infection, which is also a sexually transmitted infection, that can also lead to the tubes getting blocked. But sometimes when women have infections, they tend not to treat it well because most of the time they think that they have candida infection, which is a fungal infection. You see, but it is important that every woman, when you notice that you are getting some discharge from the vagina, and the discharge is not clear colored but comes in an abnormal color like dark yellow or greenish yellow and comes with a foul smell, it is important that you visit the clinic for an assessment to be made to find out the cause of the discharge. Is it caused by a chlamydial infection? Is it caused by a gonococcal infection? Is it caused by any other microorganism that may eventually affect your tubes? So that when it is identified, it can be promptly treated. And so a lot of women normally get fallopian tube blockage as a result of an infection, which may lead to pelvic inflammatory disease. And when that happens, sometimes certain fluids are produced within the fallopian tubes, and this can lead to blockage. Now, the fallopian tubes can be blocked in various portions along the tube. You can have the fallopian tube sometimes blocking at the proximal end of the tube, that is the end close to the uterus. Sometimes this may come about as a result of certain surgical procedures that are done. For example, when a woman goes for DNC to terminate pregnancy, sometimes due to the curette, how it is used to be able to clear the conceptus from the fallopian and the womb and all that, sometimes can end up creating adhesions or certain lesions which can lead to the blockage. There are also a type of blockage where the tube can be blocked in the mid portion of the fallopian tube, the mid portion. But sometimes this can come about when the woman wants to maybe do family planning, so we'll go for tuber ligation and all that. Those ones are quite not a problem. Then you have the distal tuber blockage, where the end of the tube, which is connecting the ovary, can be blocked. And this can also come about when sometimes you have fluid formation within the tube. And so conditions like hydrosalpinx, where there is fluid accumulating within the fallopian tubes, can lead to the tube getting blocked. There are some women who, eventually have their tubes blocked as a result of poor vaginal care. A lot of women sometimes do not take good care of their vagina area in terms of the way they clean themselves when they use the washroom and all that. And sometimes the risk of a woman contracting infections after using the washroom is very high if care is not taken. For example, if you go to use the washroom as a woman, maybe you go to pass urine or you go to pass stool and you have to clean yourself. You need to clean yourself from the front to the back. But if you clean yourself from the anal region up to the front, the vaginal region, you are likely to transfer microorganisms from the anus into the vagina, which can eventually cause an ascending infection that may end up blocking the tubes. So let's take note. Then there are some women who sometimes may be thinking to themselves that they have loose vagina, they need to tighten their vagina, or sometimes they need to clean their vagina so well, so they may end up inserting certain substances into the vagina, and sometimes the risk of you transferring microorganisms into the uterus is very high when you apply foreign substances into the vagina. So we always advise that if you want to clean yourself, you need a clean water. Don't add soap to it. Just splash the water under you to clean yourself, and that should be okay. You shouldn't add any foreign substance to it. You shouldn't put things under you, because if you are not careful, you end up introducing organisms that may lead to your tubes getting blocked. Sometimes some women unfortunately get their tubes blocked after childbirth, when maybe they go through childbirth and then they are exposed to infections. When they are given their medications to treat, sometimes they don't end up taking the full complements of the medications given to them, and they end up getting their tubes blocked because the organisms that may have entered the reproductive tract may not have been cleared, and that can lead to the place getting infected, and eventually the tubes may be blocked and all that. And so when somebody has the tubes blocked, when a woman's tube is blocked, most of the time there is no symptoms. The only way to know is when the woman is trying to get pregnant, but the pregnancy is not happening for a year or more. Then when an investigation is done, then we'll know that the tubes are blocked. And so let's take notes. From time to time, you can go and run a checkup to find out if everything is okay, so that you may not have the anxiety of the difficulty trying to achieve conception. My name is Dr. Fiao from the Zoe Fertility and Alternative Medical Center. Our time is up. We'll come your way again. Bye-bye.
What is the state of your health? Do you have a case of male or female infertility? Have you been told you have a low sperm count? Do you have a prostate problem? Are you a lady suffering from abnormal menstrual problems? Never worry again. Zoe Fertility and Alternative Medical Center has all the answers to your health needs. At Zoe, we treat all kinds of health problems, including erectile dysfunction. Zoe Fertility Center has a state-of-the-art laboratory and an ultrasound scan services available. There's also the total body scan, which scans all your organs in 5 minutes. Yes, you heard right, in 5 minutes. Our pharmacy is well stocked with good and highly efficacious natural medicines, all without side effects. Locate Zoe Fertility and Alternative Medical Center at Adenta New Site, behind the CAF International School, opposite Mechanical Lloyd on the Adenta Ebri Road. At Odoko, we are near Nicolisi Hotel, behind International Needs. Odoko Terrazzo. Call 0205 363614 or 0243 239534. Zoe Fertility and Alternative Medical Center, excellent healthcare, our hallmark.